Okay, well I'll drop in tomorrow morning with it then.
Well, I'm a project manager of a chronic disease management program, and it's trying to look at better ways of managing people out in the community. It has a outreach nursing component, but that's just one component of the program. It's actually tapping into community services and rehab programs in the acute and primary sector, but also fostering greater ties with the patient back to the general practice as well. So trying to build those links and improve communication between all three sectors: community health centres, GPs, and here at the Austin.
Walking now that you've had this
It evolved a couple of years ago when the Department of Health looked at how they were going to manage the demand over winter, and they released a certain amount of money, and we came up with this idea of how we were going to decrease the demand on our respiratory unit. And so someone gave me a pager and a pulse oximeter and go to it and see how well you do. And in that 6-month pilot, I recruited about 32 patients and just basically went out to their homes and discussed with them what they thought was wrong with the system and what they wanted out of it. And they wanted something similar to a hospital in the home or RDNS, but there was a continuity. When they come into hospital, the faces are all different. So it's a myriad of different ways of approaching patient care, but we've brought it all into one model, and the patient is the centre of it, really. For one thing, that you're going into the patient's homes and doing a medical model sort of assessment and doing all those parameter checks, but you're also looking at their social and isolation needs, their aged care needs, what services in the home can be optimised, how we can actually increase their socialisation in the community, greater access and equity for services out there.
Yeah, you only need one course of antibiotics and then 3 more days of 5 milligrams of prednisone.
Because it's all about trust, because these patients, because of their chronic nature and the way they utilise the health system, a lot of people don't think that they can really benefit them anymore, and so they sort of lost some of that trust within the system. And through just persistence and helping and opening up different doors and avenues for them, you built that trust back, and they're very happy with the health system again. And the clients themselves, there's a huge satisfaction rate, and then that is reflected in their utilisation of the Austin here. There's been nearly a 60% decrease in ED presentations and readmissions and length of stay, and they're all happier to be at home.
God, you are a lot better.
Oh, I can.
Yeah.
Because this client group, up until this program was around, were the frequent presenters. They thought themselves as the rolling doors of the hospital, and a lot of them are depressed and have anxiety issues, and we actually deal with stress management for them as well. So holistically, their quality of life and depression scores are a lot better.
Well, your weight hasn't changed for about 3 weeks, so that's good.
Specifics of it are chronic heart failure and chronic respiratory disease. So it's your chronic obstructive pulmonary disease, your bronchiectics, your pulmonary fibrosis and chronic asthmatics, and chronic bronchitis and emphysemics. If you look at studies throughout Australia and around the world, there are huge burdens on the health system, and they're usually your frequent presenters, and they're usually over 65 or 45 years of age. The mean age of our patients that have gone through the program are actually 80, but there is no parameters in severity of disease. Like the traditional markers for both cohorts has been the FEV1 or your left ventricular dysfunction.
Next Wednesday.
But both types of patients, the number one factor is a holistic approach to management, case management, but also exercise. Heart failure patients, realistically, probably 5 to 10 years ago, we didn't think we could exercise them. But the heart failure rehab program that was started up under this program has had huge benefits for the patients, where they've improved their exercise tolerance over 6 minutes of up to 90 metres, which is quite phenomenal. And that's the same sort of comparisons that you have in your traditional pulmonary rehab programs.
All right, thank you.
Thank you very much.
How are you going, Bill? Hi, Connie.
Hello, Belinda.
How have you been?
The biggest impact out of the clients would be Connie.
Monday?
When I first saw her over a year ago, her anxiety levels were phenomenal. Terribly apprehensive, because she was basically discharged from the organisation here, expected to fail at home and be in and out. because when she's sitting at rest, she requires 7 litres of oxygen, so she doesn't have much respiratory reserve whatsoever. And she's basically isolated in the home. The only way she can get out because of her oxygen requirements is via an ambulance. And through the use of anxiety and stress management and continuity of care and me sort of forming that relationship with her, she has not had an admission back in the hospital for 15 months now. And that's a big win. She thought she wasn't going to live past a month being at home. And I've tapped into services like domiciliary dental and optometry as well, so she hasn't really missed out. And she says that even though her quality of life in comparison to what it was before she had this disease, she never expected to actually live this long with it, so she's very happy.
All right, this draws the air out of the room and filters out the carbon dioxide and the nitrogen basically. But most patients that are dependent on oxygen will only have one, and Connie's an unusual case because the amount of oxygen required at the moment, she's having 7 litres per minute, so you won't see hardly anyone with 2 concentrators set up. And so that's why for her to get out of the house it requires an ambulance, because we can't give her that amount of oxygen in a cylinder. It only lasts about half an hour, 3/4 of an hour, so she's pretty much based at home all the time.
Because she's so isolated, the first time that she got out of the house for a social function, I was invited, so I took her out in the car and organised her oxygen cylinders and all that sort of thing. So you become part of the family to a certain degree.